Hello and welcome to Dantashastra. This channel is created to boost your clinical knowledge and skills. As a part of it, let's start our journey with the basic diagnosis and treatment planning. Of course, we have all studied the importance of history taking during the college days. However, it's not practically possible for us to take all the detailed history in the clinical setup. Hence, it is at least important to not skip the whole history. Rather, we would take note of few important things that help us in arriving at a diagnosis. So today, let us see what those important things are. First things you'd definitely ask from any patient is their name and age. Once you get those details, you go for the chief complaint. Your chief complaint can be swellings, pain, deposits, decays, and so on. It can be anything. And then comes your history of presenting illness. History of presenting illness is something in which we will be asking the leading questions to the patients, which will help us in arriving at a diagnosis. That can be the type of pain. If the patient complains of pain, for example, you can ask if it's a nocturnal pain or a diurnal pain. Is it a continuous pain or an intermittent pain? For how long has the pain been there? Is it a sharp shooting pain or is it a throbbing pain? All of these are the things that you would ask of a patient when they complain you about a pain. And then comes the medical history. Whatever you ask or not, the first things you definitely ask of a patient is whether they are diabetic or not, they are having any hypertension or hypotension, whether they have a heart related issues, whether they have a thyroid. All of these are the basic things that you would ask. But there might be some kidney disorders that you might forget to ask, or there might be some other gallbladder issues, or any things that the patient might have undergone treatment for or is currently undergoing for. If you simply ask a patient if they have a diabetes or not, they will tell if they have it or not. You ask the patient whether they have a heart related issue or not, they'll tell if they have it or not. But rather than asking each and everything personally, name to name, in which you might have a chance of skipping it, it's very simple for you to make a generalized question, and that question would be: are you under any sort of medication for any other health issues? Simple. This one question is a full stop. Okay. Once you ask this question, the patient has a higher chance of revealing if they have undergone any treatment or if they are taking any medications for any ailments, or if they are in plan of getting any surgeries done, or if they have already got the surgeries done. Any of the things, if the patient has anything related and they have to say something, this one question, which is, are you under any sort of medication for any issue? So if they have had any history in past, they would definitely give you the answer for that. And once they give you the answer for that and something is revealed, then you ask the leading questions again. For how long have you been taking these medications? What is the dose of those medications? All of these questions can be asked once the patient reveals that they have any relevant history. Once you have the medical history, ask for the dental history. Ask the patient if they have got any dental treatments before. If they have already got the dental treatment, it's much more easier for you to treat that patient, because the patient basically knows how it goes in a dental setup, and what will be done, what will not be done. And also you will get an information about the behavior of the patient, and you will also get to know whether the patient had been prescribed any medications, whether they have allergies for that or not. All of these informations you'll get. Once all the above information has been gathered and all the history has been taken, then comes your examination part, your extraoral and intraoral examination. Until now, it has all been the conversation between you and the patient. Now comes the actual checkup, okay, where you will examine the patient extraorally and intraorally. And once your examination findings have been arrived at, then you take the radiographs if necessary. If you have taken any radiographs, then correlate your radiographic findings with your extraoral and intraoral findings, and then relate them to the medical and the dental histories, then arrive at a treatment plan. When you follow this sequence, you will cover all the required information that is necessary for you to arrive at a diagnosis. Let us end today's video with this, And in the next video, let us discuss about the extraoral and the intraoral examinations. If you have any suggestions or you want me to discuss any particular topic, please let me know in the comments. Do like, share, and subscribe, and thank you for your support.